All right. Okay, folks. So just still working on letting people in. We're just gonna go ahead and get started now, and in order to honor everybody's time. So if you don't know who I am, my name is Amanda Pauley. I'm the Peer Support Program Administrator for DBHR. I have a handful of duties, but mostly it's right now to talk to everybody about what's going on with Substitute Senate Bill 5555, how that's going to affect us moving forward, and what we're doing in order to help that move forward. Before we get started, I should also say my pronouns are she and her, although it says it on the screen just in case. And Teresa will be here with me today as she is the peer services supervisor. I'm sorry, Teresa, I struggle with that all the titles. She's in charge of the peer team and the stuff that we're doing. And she'll be here to help answer questions as well. And so we'll probably tag team back and forth a little bit.
This is Karen. Hi, Joe. Yeah, she did say when you get back in Clark County to get a hold of us.
Maybe
Yeah.
remembering to mute.
Yeah,
that would be good too.
no, we'll start over.
So sorry, my computer's running very slow. So every time I hit a button, it takes 5 years for it to click. So all right, so here we go. Oh, Terrence, you're wearing your So Good shirts. Oh, you're wearing your So Good shirt. Yay. I wore mine the other day on a peer call. So that's wonderful. I'm so glad to see. So good. All right, we'll have Terrence share with y'all what So Good means later before we leave, if you're interested and we have time, because why not call my friend out? So anyway, Teresa, do you think that while we're getting started, you can help me with the admit button? Because I keep getting distracted and turning my head and I feel silly.
100%. Just make me co-host and I'll got you, girl.
Oh, yes. Oh, I apologize for not making you co-host. That was the intent the whole time. And co-host duties. All right. So let's talk a little bit about some stuff moving forward. Before we get started on the SB 5555, I want to tell you that this year, because it is the peer blend, and I wasn't here for last month, we are a year, and this is our 13th peer blend. So congratulations to all the peers for showing up. Yay! So glad to have you all here. And thank you for your attention, especially in this matter. I know that this is a big situation for everybody, and we all have a lot of questions. Please know that I'll do my very best, and so will Teresa, in order to answer them. Kate is here too. There's a possibility she'll be able to answer a few things as well. I'm not 100% sure, and there are some things going into this with full transparency. There are some things that we are just unaware of yet. There is some stuff that is going to be cloudy. There's some stuff that's going to be a little murky. So please be patient with us. And as you know, it's a big deal for me to be as transparent as possible with every one of you. But if I don't have the information, I just don't have the information yet. Okay, so all right, so SB 5555, it has kind of been coming down the track for a few years, and it's actually going to be amazing. We're all sure of it. It's just going to take a big lift and a lot of work. So we're rapidly moving forward with that. What does SB 5555 mean for peer support? As of right now, every peer working and billing Medicaid under that agency affiliated licensure will need to take a gap training. That gap training is 40 additional hours. We are currently in the middle of sending out a procurement soon to have the gap training for competitive procurement, to have somebody come in and do the gap training for us. But it will also include the 80-hour training. So what that's going to look like is an update of our entire curriculum, how we're going to shift it out to 80 full hours, what we're going to bring into it in order to fulfill that need. So there are questions around, are we going to use the crisis training as a gap training? We don't know. Are we going to pick and pull from other things? Hopefully, all the good stuff, cram it in there, right? But we also know that 40 hours is not a very long time, even though it feels like a long time for all of the information that you have to take in, especially in a CPC training, and especially with all of the responsibilities that come with serving others as a peer, especially. So I think that we have a lot of questions ourselves at the state level. There will be a ton of opportunities for each one of you to have a place at the table and ask questions. We'll be sending out surveys. We'll be discussing this regularly. And part of the procurement process will be that we have to absolutely have community voice in what this is going to look like. So this is your curriculum too. It's not just the state's. It doesn't belong to just one person. This is everybody's voice. So let's start there at the GAP training in the 80-hour and answer some questions. I really, really want this to be an open conversation. I would prefer that if you want to speak in the chat box, please do so. We'll do our best to monitor that. If you want to come and talk to me later and have a meeting because you don't feel like talking about it openly, that's okay too. We'll discuss. So please know the floor is yours right now. Please ask the questions that you have to ask about the GAP training and what that means. That's a really good question, Brian. We're not sure yet. That's a Department of Health question, and we'll start having a lot of meetings with the Department of Health moving forward on what it's going to look like for us. Would it be amazing to grandfather everybody in? Heck yeah, that would be wonderful. And hopefully that could be the case. We can't make any promises. There are no solid plans for that at all. And so we, that's one of those murky things where we're like, we're not sure, we're really hoping, but we're right there with you. We don't want to have everybody sent. No, Mark Anthony, it won't be another 80 hours of training. It will be an additional 40. It would be an additional 40 hours on top of the 40 hours you've already been trained in and certified in. Terrence, you have your hand up, please.
So thank you for clarifying that. So I understand that there's the extra 40 hours that we will be required to do. After this goes into effect, will people who are starting out doing prerequisites, trying to get trained or becoming peer certified, will they be required to do the 80 hours?
That's a really great question. What do you think, Teresa? Do we have any additional information on that?
I mean, I think that this is one of those really gray areas that we just don't know. We are working directly with the Department of Health to figure out what it's going to look like as far as people who are already certified and people who are just coming on. Right now, what we're doing is what we've always done, which is the 40-hour training. Our plan is to do about 100 of those this year. They're already up and running and going, and those are just going to be the 40 hours. We are hopeful that there will be some sort of action where those of you who have been doing this for a while and have a lot of hours under your belt and certification can just transition now into a fully certified and licensed peer supports, but peer specialist, certified peer specialist.
Certified peer
That's another
specialist.
one of those. So I think that it will be figured out in the next year. Sorry, my kid just came in and totally distracted me. No, you can't say hi to everybody. Go. So sorry if that didn't answer your question. She's got great timing.
Between kids and dogs, right?
You're right.
So
does training mean testing a new certification? I wouldn't think that you'd have to retest.
So I'm not sure that you would have to retest. I think that but we don't know yet. That'll be down to Department of Health. Hello, Annette Jones, I see your face. So I think that would be down to Department of Health and figuring out what that looks like. I know that the word stakeholdering is not everybody's favorite. We get it, but really that's what this is going to boil down to. Each one of you has a stake in this, right? And it's really important that we're reaching out and saying, hey, if we reached out and said, hey, we need you to come and talk to us about what you want to see in the curriculum, the things that are in there now that you don't want to see in there. What are we going to pick from? What are we going to pull from? What are we going to add? And so let's see. And then moving forward from there. So this sounds like it's going to cost double the cost of providing CPC trainings. Are there any gap plans to address the needs for groups that have limited funding capabilities? Well, we don't charge for our trainings. So if it's an 80-hour training and it goes up, then we'll have to move obviously forward with what that's going to look like at state level. But as far as yes, Brian, we have almost 9,000 peers statewide, and it could be difficult getting them trained, but they only have to be trained if they are actively doing peer support and billing private insurance or Medicaid. So it really wouldn't be 9,000 people. It would probably be about half of that maybe right now. So that's because not all 9,000 peers in Washington State are actively peering. Thomas.
So I'm just trying to get a little bit of clarification on that. So the peers who are not actually working for the agencies, but they are CPCs, do not have to take the training, but which means they can't be licensed. Am I correct?
Right. So the whole point of the 80-hour training is what's going to happen is that the agency affiliation for our certified peer counselors is going to go away. It was never meant to be longstanding to begin with, from what I understand. And so, and it's not self-sustaining. So a big part of what's happening is when we shift over to the 80, it won't be an agency affiliation anymore. It will be a licensure, a different kind of, different altogether. It will not be agency affiliated. However, if you want to bill insurance, you want to call yourself a peer specialist, and you want to, and that includes Medicaid or private insurance moving forward, you will absolutely have to be certified in the 80 hours. Just like you would have to be certified, pass your test and get certified as a peer right now to bill Medicaid with the agency affiliation. So it's basically just shifting things this way and adding more to them. So the rules will basically stay the same as far as you can't bill unless we can prove that you passed your test and that you're certified and you've done your hours. Much like a lot of other professions. Cindy? Oh, I'm sorry, Thomas, did I answer your question enough? We can keep going. I could talk all day.
Yeah, so sort of. I'm a little confused on it, but for the most part, yeah. I just want to. I'm just trying to figure out if they're like, say, for instance, someone who's not in a peer role, but like, or they're not actively as a like in a peer position, but they actually want to be but they want to do peer support as a licensed peer, but they're not an agency affiliated. Maybe they want to start their own or something like that. Is that a possibility for them to get those same credential, that same credential?
Teresa, do you want to answer that, or?
I'm Thomas, to say that again, because I'm confused about what you're asking.
Okay. So what I'm asking is, because you're saying that it's an agency, the agency affiliation is shifting, right? But it'll be a licensure all within itself.
Yes.
But for someone who is not necessarily working for an agency affiliated agency, but they're a CPC and they've got their agency affiliated previously, but now they want to do it because they have a license. I mean, because they want to get licensed, but they're no longer with the agency. Can they still take the the extra hours and be licensed?
So it's completely voluntary, for one thing, right? So if you work for an agency that doesn't bill for Medicaid and you're working as a certified peer counselor, you do not need to go through the process of getting a license through the state unless you want to. Okay, so think of this kind of like before we had CDPs and CDPTs, we had what was called registered counselors. So the registered counselor license sort of like just covered everybody who was sort of floating out in that no man's land sort of thing and the licensure field. So the agency affiliated counselor has sort of taken that on at this point. And right now they have like 20,000 different agency affiliated counselors in the state of Washington. And these are just people who got this license so that they could bill for this specific thing. And CPCs are just one of those, right? So now the state has decided that certified peer specialists are going to be their own licensed credential. And they're going to be peer specialist trainees, and there's going to be peer specialist supervisors. And so if you want to bill for Medicaid, you're going to have that licensure in order to have the NPI number in order to bill for Medicaid. And some of you aren't ever going to do that, and it's not going to be worth it to you. The rest of you will want to do that. If you no longer, because it's not an agency affiliated counselor license, theoretically, you could have your own peer program that's contracted with the state, and then you have your own license and you can bill independently of any behavioral health program, you know, however that's going to look. Did that answer your question, Thomas?
Good. Thank you. Cindy, you're next, please.
Yeah, I think a little bit of it got answered, but I was trying to figure out if how you were going to do Medicaid billing, because it's oftentimes difficult or challenging to get a contract with the state to bill for Medicaid. So if you just, like, I'm going to start Cindy's peer support service. I'm just saying, using this as an example, but if I was going to start Cindy's peer support business, I need to first get a contract with the state so that I can bill Medicaid, that MPI number. And then as long as I'm a licensed CPC or a peer specialist, I can bill Medicaid. And then the other thing is we don't bill, well, I work at the ASO, but, and that's crisis services, but, we don't bill Medicaid, or we don't bill private insurance. So I'm just trying to understand how private insurance fits into this.
Did you want me to take that? Or you got it?
No, I'm going to hand that one off to you just in case I say something wrong. I don't want to give misinformation. I think I have a beat on it, but I'll hand it off.
I mean, I think you and I are probably in the same place about this, so that's fine. So no, not everybody, mostly this will be Medicaid. I think the idea of billing private insurance is going to be something that grows over a longer period of time, because I think the private insurance companies are still really feeling out what this all means and how this will apply to their services and whether or not they're going to pay for it. But having the licensure is going to make that a lot more conducive to something like private insurance in the long run. But I wouldn't count on any of those particular eggs just yet.
Correct.
I think
you.
private insurance is going to take a bit longer before they say, oh yeah, we'll pay for something like peer services. Whereas Medicaid, we're solid.
I think in the bill it called out something about the Attorney General of Insurance or something like that, saying, hey, let it be billable. But it doesn't as you know, in case you don't know, everything like governmental takes a minute. That is something that will take a lot of minutes. So as far as billing privately, just like Teresa said, it's gonna take a second. Shelly, just 1 second really fast, and I want to address something that was hidden in the chat. Somebody asked, can you provide more details on how the GAP training applications will be prioritized? As far as I understand it, we absolutely will be prioritizing GAP trainings for individuals who are currently working. So if somebody comes to us and they say, hey, we want to work, and we have this 40-hour and I haven't done this in 3 years or whatever that looks like, can I take the GAP training? Absolutely. But individuals who are currently doing the actual work will absolutely be prioritized into trainings as soon as possible, if the grandfathering situation doesn't happen. Okay, did that answer it slightly, Kathleen?
I was hoping for some more details. We currently have a prioritization of 1 to 5. And so what I hear you saying is that you now know what number 1 is. Are there any details about how other folks who are not currently working as a CBC in a Medicaid organization will be prioritized? That's
We
my
don't,
question.
yeah, we don't have any information on that quite yet. It's a really great question, and actually something that we need to bring up to the surface as well in consideration. Right now, I think our biggest push is getting the procurement out the door in order to get the actual training created. Because I believe it has to be done by July 1st of 2025. And that is not a very long time, as Stephanie can tell you, to write a curriculum, let alone an 80-hour curriculum. So because this RFP will be for the 80-hour training as well as the GAP training. And so there's all the trainings. We're going to have all the trainings. It's going to be, we thought the 96 that we're doing this year plus the 10 DOC was going to be a lot, but moving forward, we're going to have a lot of trainings in order to be able to mitigate everybody who still wants to, who's actually working, who's not working, who wants to work. And so figuring out what that prioritization means moving forward after this is really important. So hopefully this will be a conversations that we can have with the peer support advisory group as well, so that we have as much input and voice as possible between trainers, organizations, our testing proctors. Is that okay? I wish I could give you more.
Thank you for the clarification. I appreciate it, Amanda.
Absolutely. Thanks for your wonderful questions. Shelley, please, you're next.
I just wanted to introduce myself and also provide a few clarifications for the questions that already being asked and answered, if that's okay, Amanda.
Sure.
So I'm Shelley Shore. I'm the peer support planning and policy and planning manager right now for the Healthcare Authority. A few clarifications. We still, like Amanda and Teresa said, we know what we know and we don't know what we don't know yet. And this is a process. Cindy, you were asking about how can individuals be involved in this process and provide feedback. The Department of Health is going to get an announcement out about rulemaking and how can the community be involved. The best way to be part of that is subscribe for the listserv for the Office of Recovery Partnership, and we can provide a link for that in the chat so everyone can be involved. I also wanted to say something to you, Thomas. You were asking about going through the training and then having your certification or licensure independently. Again, we don't know everything, but we have to remember that there will be two, basically, I want to say tracks. And the first step after training, you will be certified peer specialist trainee. And to become fully licensed, you will have to have 1,000 hours under supervision of work. So that's another thing that we need to find out more about. How can people that do not currently work as CPSs or CPCs can do that without working as peers? So just wanted to add that layer to the complexity of everything that needs to be still planned ahead or figured out. So I hope that makes sense, and I hope that's another clarification. And also, I believe that the licensure fee for the next 5 years will be $100 as it was in the bill, but I might be wrong. That's it, and I invite you to write to us and ask questions, and I'm going to put the link in the chat for the listserv if you're interested.
Got you covered there, Shelley.
Okay, let's take a, oh, my video's off. Okay, so apologies. The only ability today for the caption is going to be through the link. For some reason, it's not behaving itself. So I'm just looking through to make sure.
I just
So,
want to say, the questions in the chat are like really great, very detail oriented questions that we're not going to really be able to answer yet. And I
yes, a lot of them.
apologize.
I'm going through, I'm like, gosh, which ones can I answer? I think that what's really good about this chat though, too, is that we'll have the ability to pull it and address all of these questions, maybe maybe in the next peer newsletter, we can have a link where it addresses the questions and updates for SB 5555. That might be the best that we can do for some of the more detailed stuff. Yeah, it would be great for FAQ. Thank you, Stephanie. Absolutely. Lamont?
All right, thank you. So I do not work as an agency affiliated counselor. However, working for a federal government, but I'm thinking a couple other peers who are working may have the same situation. When you're writing patient notes, you may or may not have a supervisor that co-signs them. So technically your notes are under their billing code.
Right.
So you're already writing notes, whether it's for Medicaid or not. I'm writing CPRS. So I bill anybody, whatever, it doesn't matter what my client's insurance has. How is that affecting me in the fact that I've never been an agency affiliated counselor, but still the VA wanting us to maintain licensure in the same way in which your state is asking? And I'm sure a lot of the RSNs are doing the exact same thing.
Does anybody want to tag this one in, or do you want me to try to chew on this one?
I'm going to let you.
Okay. So let me make sure I understood exactly what you're asking. Basically, you're not working as a certified peer. You're not.
No, I've been working as a peer for 10 years straight with the VA.
Okay.
But I'm not an agency affiliated counselor because they don't require that in my position. So the state would not look at a list and say, oh.
Well, I'm not, I guess I'm a little confused as to how you are able to write notes and bill Medicaid if you're not an agency affiliated counselor.
So I've got my peer training back, and once I got peer training, I later got employment here at the VA. There's a process where you request your agency affiliated counseling certification. As a federal employee, that's not required. All I had to do was show them my certification. I was later hired. When I write notes into a patient's records, I have a supervisor. That supervisor is an LIP. That LIP co-signs my notes. So it's really under their license.
So, but okay. Shelley?
So what's
can
the
you
question, Lamont? Is the question like, how are you going to do this in the future?
Well, I'm sure Uncle Sam is going to figure that out for me to a certain degree. However, I supervise volunteers and other peers here. One of my duties is to make sure that they stay current with their state licensing. So I'm hearing that this state licensing is changing. So I'll need to be able to communicate this succinctly to my supervisors and then to my subordinates, and then make sure that they follow through appropriately, including myself. But on top of that, you said there's a prioritization that will be done based on what the state sees as employed peers who are operating under an agency licensure. I am a decade employed peer certified through Washington State who has never applied for agency affiliation, and therefore seems like I'd be way down on the list or not even nowhere near it, and that would be inappropriate for me.
So I have a question, Lamont. Are you billing peer services under the SERI code?
Under series code H0038, correct.
Well, since you're working as a peer currently, you would be high on the prioritization list. However, for the additional training, but that's the best I can give you right now. I've never I've never heard of anybody being able to bill without an MPI, whether they're certified or you know, whether they're federal government or not. And so my head's kind of trying to wrap around that a little bit, but I would assume that Shelley, did you want to speak up about this? Is that why you have your hand up?
Yes, I wanted to say that I think this conversation should be sidebarred actually, and it might be a little different with the VA. So we have a conversation with the VA, I believe, next week, Amanda. So how about Lamont? It's a really great question. Let us get back to you. Put your email in there if you want to, if you're interested, or send us an email, and we'll figure this out for you.
Thank you.
Yeah.
Thank you.
The questions you guys are asking are
Great.
amazing questions that we're not at that part of the process yet. Where we're at right now is we've been given past legislation that we have to now build the program to suit this legislation. And so we are meeting every other week with the Department of Health to talk about how we're going to collaborate with the Department of Health and the HCA to figure out what this new licensure is going to look like, how we're going to make sure everybody gets what they need so that they can continue to work. Because the whole point of this was to make it more accessible to have peers in the workforce, not to limit peers in the workforce. So everything that we're going to be doing is going to be trying to make it easy for everybody who's already in the workforce to stay and be okay, and anybody else who wants to be in the workforce to get in there as quickly as possible. So that is our goal, is to figure out how to do this as smoothly as possible. And we want to be transparent. We want to be talking to all of you about what's going on and how this might impact you, but there's so much of this that we just don't know yet. And even at the risk of confusing people or maybe causing stress, we want you to know that this is happening and we're working really hard on it.
And thank you for the good information. There was a lot of stuff we weren't aware of as far as that, you know, billing and stuff like that went for federal situations. So that'll be a new one to sink our teeth into too, to make sure that we're covering as many people as possible. JC?
And then.
Hey, thank you, Amanda. Recognize a few names here today, and just wanted to kind of hopefully not kind of be redundant about some other questions. I went and looked back to the chat, and I guess after hearing Teresa and Shelley too, one of the questions was just like, so there's known, right? And then there's the unknown that's being worked on. And I feel like that's around like supervision hours and things like that. One of the questions I saw, and maybe you guys can address, is just like the licensure aspect of it, because I mean, like the cost is going up, and our agency, for instance, at Columbia River, you know, we get not necessarily a stipend, but we get a portion of that covered. And then we also have, say, education dollars. And so when you're talking about the trainings and things like that, are these going to be offered free? Are these paid for? Who's going to be the ones basically footing that bill? You personally, Amanda?
Me personally, it's coming right. Nice. It's coming right out of my bank account. No, every training, that's right, Terrence. It's so good. So every training that we offer at the state level to our peers is always free. Always. We will never ever charge our peers. That's the steadfast rule. So all of this, when we were given this legislation, they were like, here, take this money while you're at it and make it work. And so that's kind of what we're doing right now is when we like the 96 trainings plus the 10 DOC that we're hosting this year, nobody attending those trainings has to pay for it. And so it'll be the same moving forward with the GAP trainings and any of the additional you know, supervisor training, the 40-hour crisis trainings, RAP trainings, IPS trainings, all the trainings. They're always going to be, if we offer them, they're always going to be free. We won't even we don't even advertise trainings for peers that cost them money. It has to be free, even if it's not coming from us.
Okay, with the caveat though, right, is if it's online, easier to say that, right, than say if it's required in person and you're someone who's not in an area where training is being served.
Hold on, say that one more time. I don't think I wrapped my head around it quite right.
It's okay, like if any of the trainings, right, like my certified peer support training was done in person.
Right.
So I didn't necessarily have to travel, hotel, food, things like that. So I'm just saying for like rural, peers,
Absolutely.
people like
Yeah.
that, right? The cost of the class, but the cost of maybe attending the class, that is not covered.
So the cost of attending a class is covered if it's statewide. It's part of the contractual agreements with the training organizations. So if it's a statewide event, then yes, travel, food, and hotel is paid for. However, there will be virtual options because we do honor and understand frontier and rural communities, as well as sometimes childcare, leaving your home. I have 3 dogs. So, like jamming out for a week could be pretty hard. So without those natural supports, which a lot of individuals don't have those supports in their areas. So it's really, we'll do our best to make sure it is as accessible as possible. That was a lot of S's.
It was. Well, thank you for that. I don't want to take up too much time because there's other hands raised, but thank you for addressing that.
No problem. Thanks, JC. Do you have an add-on, Shelley, or can I go to the next person?
Just an add-on about the continuing education. We're not sure how that will look like though, because with other licensures, you have to find your own continuing education. So Amanda, am I wrong? Is it something that we still need to figure out with the
Yeah, that's part of moving forward with the development, with the program development, we're working on it.
Yeah. So I'm just
Yeah.
saying this is one more thing to advocate for.
Mhm.
We at the Healthcare Authority advocate for all the good things. So grandfathering, that's another word that
Yes.
I want to use, but and making it as easy as possible, as accessible as least expensive as possible. But when those opportunities come for you all, for the community to advocate for things, these are one of the things to pay attention to as well.
Yes, and please keep your eye out. I will work with Shelley, hopefully, to create a new survey so that we can say, hey, what are your concerns? Is this a concern? What is your primary concern? Are you currently doing this? What does this look like for you? And it will be completely anonymous, unless you don't want it to be, then you can throw your name in. So, but it'll be really good for us to have that as often as possible, so that we can share that information too. And I know surveys, blah, but it is a way to get your voice heard when we can't do this every single week. Although I'm starting to feel like maybe we should. So I'm going to try not to butcher a name. Is it Maame or Mame? I apologize.
Mame.
Beautiful. How can I help?
Yes. So you're addressing the topic of the financial piece of this, but just for clarification, so you're still working on finding ways to support peers if they're having some financial challenges with licensure and CEs?
As far as the licensure goes, I do believe that the opioid dollars are going to be used for until 2028 to help lower the licensure fees for peers who are shifting into the CP, the certified peer specialist role.
2030. Until
20.
July 2030, it's $100. I'm not sure if it's for 1 year or 2. You might know that.
I'm not sure yet. I thought it was for 2, and then I think
it's like 2.5.
Yeah, and I think the continued education, piece, we're, like Shelley said, we're not sure what that's going to look like, but we're really volleying for, to be able to have CEUs from conferences, and being able to do stuff like that. So keep your ear to the ground on that one. I feel like I missed part of your question. Did I miss part of it?
I think you've been talking about it previously and now. So it sounds like a lot of it is tentative, well, half and half, or a mixture of sure and unsure, as the person before me spoke about. So thank you.
Thank you. I appreciate your questions. Okay, Eric, I see your little hand up there.
Good morning, ma'am. How are you?
Good. How are you, sir?
I'm doing well. So I have a couple clarifying questions. So we've identified that we're going to have to, develop a curriculum for an additional 40 hours. What does that look like for the agencies that have been approved to provide the CPC trainings? Are they going to all have to adjust their curriculum as well to format it in an 80-hour format?
Well, to be fair, Eric, your curriculum should be our curriculum with only a difference in change when it comes to the skills.
Yes, that's what I'm
right.
referencing
So
to.
yes, what we'll do is once it's out, we'll hand it over and say, keep it the same, but make it your own, because that's acceptable and that's what we want. But you have to make sure that when we're doing that we don't deviate too far away from it, because all of the questions on the tests are going to be based on our curriculum. So if you
absolutely.
Okay, cool. So if you shift away from that too far, it could cause some it could cause a little damage.
So I'm not so much concerned about the content itself. I'm
Train the
concerned.
trainers.
Well, that's part of it. So thinking about like the back end from my agency's perspective, right? We're allotting a certain dollar amount to be able to facilitate these trainings, right?
Right.
And my programs, unfortunately, are very limited in funding capability. So, taking an arbitrary number, between 25,000 and 35,000 on average for a 40-hour certified peer counselor program, my agency is going to have to probably dish out double that for us to be able to facilitate a 2-week course. So I'm just thinking in the back of my head, like, how am I going to do this? Because
That's a really good question. Yeah.
Because that's going to severely handcuff us.
That's I can understand where you're coming from. I could see how that could be incredibly daunting. And thank you for bringing that up to the surface. I know that there's some concerns around trainers being worried about having to retake train the trainer, which will have to happen anyway. And our trainers will have to take the additional 40 hours just so that they know what they're training on. And so it's going to be a really big lift. We'll do everything that we can, Eric, to support as much as possible and find ways to pad if we can, or bring down costs as possible as necessary. But right now, if we were adding the math up, that you're exactly right. It's going to be basically double. So so we're gonna have to figure out a way to make that work for all of us.
Okay, thank you, ma'am. I appreciate
You're
it.
welcome, sir. Whew. Okay. 47 minutes in, we've done good so far. All right. Oh, Stephanie, thank you. You wanna jump up there and say anything, or you want me to just read it out loud for you?
No, I don't want to interrupt the flow of 555.
Okay.
I just if you're interested in becoming a facilitator for the Washington Peer Network's 21 Zoom leadership and self-help groups, hit me up or come visit our table at Peer Pathways. Talk to Thomas as well.
Thanks, Stephanie. Thanks, Thomas. And this is really a big deal too, because the Washington Peer Network moves hand in hand with everything that's going on, ways to support peers in the community. And we need a voice. We need extra voices at the table saying, hey, we need support here too. So being able to get in there and train and facilitate and get to know people and be an ear, just like we are right now, is going to be a really big deal. You know what, Kathleen, that is a really smart idea. Let me talk to Teresa about that offline and see if we'll be providing any updates at the conference or not. So I actually think that's smart. They may be able to do some updates in the opening with Carrie Waterland. So that may be a possibility too. And then of course, you can always just grab me by the arm and drag me down the hallway and ask questions. That's okay. That, Brian, is a really great question for Annette or Lauren. I'm unsure. Mom, I'm so sorry. I suck.
What? You don't suck. No, thank you though. I know people are trying to say my name, which I appreciate.
I think it's wonderful. It's a beautiful name. I just wish I was better about it.
Yes. Well, I just had a message because you've shared some words about this is a work in progress, and trying to make sure you're advocating for the peer community, and as we see a lot of these changes. And one thought I have is that with some of these concerns with the legislation about you know, what are the licensure fees and everything, and whether or not this would affect the workforce. Just someone has, you know, between two worlds, and I know a lot of peers have different, you know, credentials. Like in, for example, I'm in social work, and if you see the counseling field historically, you know, when these changes have come, there's a reason why we have deficiencies in the workforce because of the financial burdens. And a lot of times it starts at one place and it gets out of hand because of the system, you know, the way it's set up. So I just would encourage, you know, HCA, and just to make sure that, you know, you're working with everyone that you can to make sure that the peers are supported. It is, I know it's a concern of a peer community, but just looking at other professions that start off with the intent of, I guess, a professionalizing or bringing more opportunities for that profession, it has caused, there are some unintended repercussions. So that's just something this is an encouraging, it's more of an encouraging message, but yeah, just to continue with the advocacy of this and work. So thank you.
Thank you. I appreciate that. And yeah, I promise we're working hard to make sure that this doesn't impact too strongly, but unfortunately in some areas, in a lot of these areas, our hands are pretty tied. And so we're just doing our best to say, hey, that's probably not going to work out so good. How can we make this better?
Yeah, I think the important thing to remember is, you know, we're not the ones who write the laws and the policies. We're the ones that are given the new laws and policies and told to figure out how that's going to work. And we need all of you to do that well. We cannot and don't want to do this without your voice and without your input. We need to know if this is going to impact you in one way or another, so that we can try to buffer that or build the bridges, fill the gaps, whatever we need to do, because the last thing that anybody wants, including the legislature that wrote this, is to impact negatively the peer community. The goal of this was to increase peers throughout Washington state, to put it in such a way that more people could enter the workforce. It's not meant to deter people. It's not meant to create barriers. That doesn't mean that it didn't. It doesn't mean that this is going to go smoothly. It just means like there was the goal and then there's the unintended consequences, and we're not going to be able to see all of those without your help. So I hope you guys keep asking these questions, keep bringing up this stuff, and keep sharing with us what it means to you or how it's coming across for you. Because to be honest, you know, the whole idea that Lamont brought up about how this might impact somebody at the federal level, you know, we're going to need to address that. We're going to need to talk about that. And Dolores brings up a good point when she says, and that means also the tribal communities.
Yeah.
So what is this all going to look like? Who do we need to partner with? How do we keep these conversations going and make sure that the information doesn't stop flowing in, even if we don't have answers for you right now?
To piggyback on that, Teresa, and that was really well said, thank you. To piggyback on that as well, I would say that one of those unintended consequences, the reason I think that a big part of this went through is because as of right now, certified getting peer services is usually only for people on Medicaid. And certified peer services should be offered to everybody. No matter what their insurance is. It shouldn't only be limited to individuals who have Apple Health. And so I would love for my insurance to be able to bill peer services so that I can go and hang with a peer and be like, listen, I need some peer time. But it would be the same thing. And I see where the good was here and then the unintended consequences down here. So we're going to have to work together to round it out as a team, everybody, all of us. Michelle, your hand has been up for 800 years. How can I help?
Thank you. Not quite 800, but thank you. And I appreciate the conversation. I just want to introduce myself first. I'm Michelle Carneth. I am a peer. I work in Clark County Juvenile Court as a parent peer. But I'm also the family tri-lead for the statewide and regional Southwest Regional Family Youth System Partner Roundtable. And I'm also the family lead for the Youth and Young Adult Continuum of Care which is a subgroup of the Children Youth Behavioral Health Work Group. And so we have had, and I'll just call the subgroup YAC. And so it's myself, Rep Davis, Rep Eslick, and we have a young person, Lillian Williamson, that are the leads in that. And peer services have come up a lot. And I know that Rep Eslick and Rep Davis were instrumental in passing this bill. And it's something with YAC that we want to keep our eye on, just to ensure that, I mean, just these conversations. So I just wanted to put it out there. I was hoping I could get your email and Teresa's email. We want to get an update on this at the YAC. We're just starting our interim session and really want to see how our group can, you know, support the peer community. And then, you know, in this rollout. So there's some oversight in this interim session. It's really short. And so there's some things that we might move forward, and the other subgroups as well might move forward, but there's also going to be some implementation oversight as well, potentially. So for me, I have a high value on that, and we have talked about it as a group, and I would say that the rest of the team feels the same way. Thank you.
Thanks, Michelle. Appreciate that. I put our email addresses in the chat box. If you want to snag those and then send us an email, we'll do what we can. You're quite
Perfect.
welcome.
Thank you so much. Appreciate it.
Absolutely. Give me a second, Robin, you're next, but I want to address something really quickly in the chat box. So where did it go? Oh, this bill includes, Catherine said this bill includes a lot of information regarding supervision of peers. Will there be any more information about these requirements? Absolutely. I'm not sure that we're going to have that for you today. That is another one of the procurements that will be going out very soon for active competition. And so what we know is what was said in the actual legislation itself. And I'm going to say a couple things, and then I'm sure Teresa's going to pop in there and fix what I'm saying. So I believe it's 1,000 hours is what has to happen for supervisors. And then we will create the requirements within the curriculum and DOH. So we'll be working very closely with DOH as well. And Teresa, see, she pulled herself right off. What are you forgetting, Amanda?
No, just in addition. But so a person who has become a certified peer counselor who has been in the field like 1,000 hours, like Amanda said, with 500 of that being direct supervision, would then go through a training specifically for supervisors. And that's what she's talking about. We're going to contract with somebody to help us develop that training. And then to be a supervisor, you would do all of that. And then you could be a peer specialist supervisor. Yeah, 1,500 for supervisor. It's like 1,000 hours of direct service and 1,500 direct supervision.
Or is it 500 direct
500.
supervision?
So
Okay.
thank you.
I was like, that's a little bit more
That's
hours
a
than I
lot,
thought.
which is tons and tons of time.
Okay, so we're rounding up. We got a couple minutes left. Robin.
Thank you, Amanda. I just had a question around, so it's kind of piggybacking off of what you were talking about before Michelle spoke about expanding peer services to people outside of the Medicaid world. And I've looked through the bill, and there's language around apprenticeship programs versus licensed behavioral health agencies. Is that the intent of the state, that we will potentially be able to do these peer services without being behavioral health entities? Granted, maybe not billing to Medicaid for those services, but through we run other programs that are not billable services, like the Recovery Navigator program that's through HCA as well, where we're constantly doing peer services. It doesn't require a peer counseling credential, but we have all of our staff obtain that credential because we think that it's really valuable. Would they potentially be able to, or we potentially, as not being a behavioral health agency, be able to have the ability to have peers under us?
Teresa, do you want to take that, or Shelley?
I'm going to try. Okay. So you said a couple of different things. So yes, there is an apprenticeship program for peers. And then there's the state training for peers. Now, for the apprenticeship programs, I'm not sure what the benefit is of going through the apprenticeship program as opposed to just doing the state certification. I know a little bit more about why that's a benefit for SUDPs instead of going to college. So I don't know enough about that to really answer that question. I think what you're asking is, if you have people who are certified, can they supervise people and bill under their licensure, maybe a little bit like Lamont was talking about? Is that what you're asking?
Kind of, not necessarily even billing services, but
Okay.
but being able to hold the credential without being under a behavioral health agency.
You can hold the credential without working for a behavioral health agency, yes.
I think from a meeting yesterday, I think what Robin's trying to say is, what if they don't want to become a BHO? And in 2 years, they still want to be able to bill for peer services. As of right now, in order to bill for peer services, you have to become a BHO and you have to add peer services to your book of business. So it's a multi-step process.
Licensure piece.
Right. So I
through the
feel like
state.
maybe the question is, moving forward with all of these new things that are happening and being able to bill private insurance, will that still be the requirement to become a BHO? Is that right? Ish?
Not exactly, but I can,
Ugh.
Amanda, I can send you an email, and Teresa,
Yeah.
I can send it, and we can discuss.
We'll hash it out. Even if
Absolutely.
we'll get together, the three of us. We'll just sit here and we'll talk about it all day long. It's fun.
Yeah, absolutely.
Absolutely.
Oh my gosh, everybody, this has been such a great conversation. We're a minute over. I want to honor everyone's time. If you truly feel like we need to have more of these meetings more often, more voice, please reach out and let me know. Our peer blends are eaten up for the rest of the year, but that does not mean that we can't throw a Zoom out and have a bi-weekly conversation if that's what it looks like we need to do. So, and don't forget also that we have a fantastic peer support advisory group. If you want to be a part of that, or you're not a part of it and you're curious what it is, please reach out and we'll do what we can to get you a part of, to get you into the group. It's really important that your voices are heard. I know we keep saying that over and over again, but you can't, you can't make a quilt with 3 pieces of fabric. So we're all here together with our stone soup and we're going to make this wonderful.
And I took a bunch of the questions out of the chat so that we can start formulating a FAQ for you guys.
Yay. Thanks, folks. We really appreciate you. Thanks, Shelly, for hopping in there and answering questions. That was really great. Aside from, we're going to let you go. This is being recorded. I will make sure I do a follow-up email and send this out to everyone. I promise. Okay. So take care, you guys.